All right, we're going to go ahead and get started. Good afternoon, everyone. My name is Alexa Schultz, and I'm the Benefits Coordinator in the HR Department for the Stevens Point Area Public School District. I'd like to welcome you all this afternoon. Thank you for taking time out of your day to attend this webinar. This webinar will be recorded, and I will email the link out once the link is available. So keep that in mind if you do need to reference anything after this presentation has concluded. And then I'd like to introduce Dave. He is from Security Health Plan. He is the manager of wellness and health promotion. Today, he's going to take us through a presentation that's going to discuss a little bit about the My Security Health Plan portal, talk about the WebMD portal as well. Also a quick review of the out of area dependent form. And then he's also going to briefly talk about the healthy living reimbursement form. Everyone is currently muted, so I will unmute everyone at the end of the presentation because there will be time for questions. So feel free at that time to ask Dave or myself any questions that you have. Thanks, and you can go ahead and take it from here, Dave.
All right, thank you, Alexa. Welcome, everyone. And as Alexa noted, our agenda will include the out-of-area dependent coverage, healthy living reimbursement, and then we'll take a look at the My Security Health Plan online account and how that will get you to your WebMD online portal, which will provide you with a number of resources available from WebMD, the leader in online health information, as well as information about the Wellness Reward Program. And I will say the Wellness Reward Program at this time is not live. We will make sure that that is live for you by next week. So let's jump in and get started here. And the first thing is the out of area dependent coverage. And in August, a letter was mailed to you with this form. And basically what this form is to allow dependents, even a spouse who might be residing or working outside of the coverage area for Security Health Plan to receive care. And that's usual and customary charges care if they're unable to see a Marshfield Clinic provider or a provider within our network. So that would have been mailed to you in August. If you do not have that form and need that form, you can call our customer service department. The information is here on the screen. Go ahead, fill that out and return that to Security Health Plan either by mail or you can email it to shpmember@securityhealth.org. And along with that form, if you don't have it, please be sure to contact our customer service. Also, it's a required form to complete annually. So each year about this time, you'll receive that form. Please be sure to look for that in your mail and get it filled out and return it to Security Health Plan. Next is the healthy living reimbursement. And this benefit is for adults, up to 2 adults per family within the district on the health plan, to provide a benefit for living a healthy lifestyle, maybe purchasing a gym membership or an online fitness program. But it provides the family up to $200, $100 per individual for purchases made that are designed to improve health and wellness. And basically from starting July 1st of this year through the end of the year, if you've been on the plan since that time, you can save your receipts that total up to $100 per person, again, 2-person max, submit that with the form, and a check will be made to the subscriber in the amount. And again, the total value cannot go over $100 per member and 200 members per family. And I want to jump in here with the eligible expenses. So if you're looking at a nutrition or wellness class, gym membership, you can even work with a personal trainer or be a part of some exercise classes, weight loss programs. And something new we included were online fitness memberships. A lot of people are doing those types of memberships, whether it be Beachbody or Weight Watchers online. And then also the purchase of home exercise equipment, something new again, that provides a total body workout. So when we're looking at this type of equipment, it would be a treadmill, a stationary bike, elliptical machine, or even a total body weight resistance machine. And that equipment would be need to be purchased from a retail company. So again, make sure you get all of your receipts and submit them with the form for reimbursement. And one thing to note as well, especially with online purchases, we've had a few instances where people have taken screenshots of the online order, say for Beachbody or Weight Watchers online. What we need is a proof of purchase, no, a proof of payment, I'm sorry, not a proof of purchase. So if you can show us take a screenshot of the credit card payment or receipt for that particular membership or online purchase, that's what we need to process the form. So be sure that the receipt of payment is what included with your form, and then we'll go ahead and get that processed. You have until March 31st of 2023 to submit your form and receipts for payment for the year 2022. And again, if you're new to the health plan, say as September 1st, you'll have from September 1st until December 31st to accrue the $100 or up to $100 for reimbursement for this year. And then next year, it'll go from January 1st all the way through the end of the year for that full benefit. And next, we'll take a look at the Wellness Reward Program. And as I mentioned, this program will go live in the portal, the WebMD portal, next week sometime. And what you can do is complete up to 4 wellness activities. Each one will earn you $300 in wellness credits. So complete at least 2 and you'll receive the full amount of $600 in wellness credits. The 4 activities are: the first, log into your WebMD account. The second would be to complete a biometric screening at an on-site event or with your healthcare provider. And the on-site screening events will start October 4th and run through November. And on the site, there will be a link in there for you to click and go ahead and register yourself for one of the on-site screening events at one of the district locations. The healthcare provider biometric piece, we have a form that will also be a part of the reward program. You can download that form, have your provider fill out the biometrics from your recent preventive exam from 2022. So even if your preventive exam was before July 1st, if it was in 2022, just have your provider fill out the information from that exam and submit it, and that will count for your biometric screening completion. The third activity is completing a health assessment in the WebMD portal. And then the final one would be to read 3 articles in your WebMD portal that relate to emotional well-being and stress management. And again, once you get into WebMD and that reward program is visible, you can start completing those activities. It's very simple to follow. If you do have any questions, you're more than welcome to contact Security Health Plan Customer Service, and we'd be happy to help you out with any questions you might have. The first thing, we had a number of questions yesterday regarding the My Security Health Plan portal, and I want to put a couple images in here to kind of show you the process for either registering for My Security Health online or logging in. So if you go to securityhealth.org and scroll down a little bit on that home page, you'll see this big blue circle here, and that's where you can either register or log in. Underneath that login key, you'll see a little word that says register under there. It might be a little small on your screen. You can go ahead and click through there to create your online account. You will need your membership card because you'll have to enter your subscriber ID, that's to the left of your name on your ID card, and follow the simple steps to go ahead and set up your username and password. If you already have an account, you can just enter your username, password, click login, and be directed right to the home page. And what's nice about My Security Health Plan Online is it's a one-stop location where you can view all of your most recent claims information. You can request new membership cards. It's kind of a one-stop hub for a lot of questions you might have regarding your health plan and your benefit coverage. It's also the location where you can access WebMD. So if you look to the right, that screenshot is what you'll see on your homepage of your My Security Health Plan portal. Once you're logged in, go to the left navigation bar and you'll see health and wellness. And below that, there are a few links there, and one of which is WebMD Home. That's what you can click on to access your online WebMD account. So to reiterate, create your My Security Health Plan online account, log in there, and then once you're at your homepage, look over to the left and click on WebMD Home. There you'll be redirected to WebMD and be able to start using the tools of the WebMD portal account. One other step with WebMD, we have a companion app. It's called Wellness at Your Side, and that's going to be the first thing I show you when we jump into the test portal. This process needs to be completed first before you can access WebMD through the online app. So please be sure to go all the way into your My Security Health Plan portal into WebMD before downloading the Wellness at Your Side app and going through those instructions to link the app to your WebMD account. So we'll jump in now to the test portal. I think that's the one I want right there. Click login. This is a test environment that we're in. And this is what your home page will look like. And the nice thing about the WebMD account here is it scales to the type of device that you're using to view the information. So if you're looking at this from your desktop or a laptop or a tablet, it's going to scale depending upon the device.
Okay,
So what that means is it, yeah, sorry.
sorry. Yep, we're
Oh, you
still on.
can't see
Nope.
it.
Thanks.
There I'm sorry. I
That's
was
okay.
on the wrong side. Let me jump back here. Oh my goodness, there we go. How does that look?
Much better. Thank you.
Okay, I'm sorry, everyone. I was looking at it on the wrong screen. So this is your homepage. Again, scales to the type of device that you're looking at. Very simple view. And when you first go into WebMD, it's going to ask you a series of questions to kind of customize your homepage. And one of those will be questions related to interests. So if I click on that right now, I can change what my interest is, whether I'm interested in quitting tobacco, maybe weight management, maybe I have a chronic health condition and want to click one of those. When you click those, it will direct information from WebMD's online resources with articles specifically for those topics. And you can come in here and change and modify this at any time just by clicking on this interest tab. I'm going to scroll down a little bit further because this is also a part of the registration for WebMD. Here's another filter down here, but during the online process, it will also have you select some different topics as well, and that will also help customize your home page. So I'm going to step out of that. And while we still have it fresh on our mind, the Wellness at Your Side app, I'm going to click here on Devices and Apps, and then click on Wellness at Your Side. So right here, the instructions on how to connect the Wellness at Your Side app to your online account. So again, going through the portal, the My Security Health Plan portal into WebMD, now you've made that connection. Now WebMD knows that you are a member of Security Health Plan. So when you go to the app or Google Play Store and download the Wellness at Your Side app, follow the instructions there, and it's going to ask you for a connection code. And you'll want to enter the word security, and that's what's going to link your online portal account through My Security Health Plan and the app. And a benefit to the app is that if your phone has these features of face recognition, et cetera, you'll be able to get in and out of your account a lot easier than always going to My Security Health Plan and entering your username and password. There is a settings option in the app that you can click on to allow the app to use facial identification to log you into the app. What's nice about that, most of us always carry our phones around. We're usually looking online through our phones. So now we have all of the resources that you have available through WebMD and Security Health Plan at the tips of your fingers on your cell device or tablet. So that's another nice feature, and that'll come in handy when it comes to reward programs or possibly even challenges down the line. There may be a time when we do an activity challenge, and if you have some type of connected device, you can automatically sync that information to the challenge. So let's say you have a Fitbit. I'll just go back to the devices and apps, even Apple Health, Google Fit, Garmin, any of these devices, if you connect it to your WebMD account, any information gathered gets pushed here. So if it's a steps challenge or exercise minutes challenge, miles, etc., all of the data that you've collected from, say, your watch or your device will automatically come here and give you credit. There's no extra step that you have to take to come back in and enter information. So that's another nice feature of connecting your devices to your WebMD account. And WebMD uses Validic, and there's well over 300 different types of devices that can be connected to your online account. And devices also such as, blood pressure monitors, scales. A number of people have those different types of devices. What's nice about this is you can send all of your blood pressures to your um, site, and then you can print that off and bring it with you to your provider's office for an exam if that's something your doctor is asking you to track. So if you have any of these connected devices, I would encourage you to jump in there and make those connections. You can turn them on or off anytime you'd like. It's your personal information, and I think that's probably a good segue to talk about the privacy piece of WebMD. So we do not send any claims data or any data related to your care to WebMD for this platform. That's something we do not do. And the other side of the coin is WebMD does not sell any of your information or share any of your information to any third party. So it stays with WebMD. And what I like about that is we have people that do need to track blood pressure for their provider, and they usually download an app from the App Store, Google Play. And most of the time, those apps are free for a reason because they're selling that information and that person gets inundated with ads. So that's one thing you will not see if you use WebMD as a tracker for any biometrics such as that. That data stays in your portal and does not go anywhere else. So that's a nice feature. WebMD follows the same HIPAA guideline that your healthcare institution uses, as your health plan uses. All of that is protected and private. So I want to reassure you with that. And then if we just scroll down the page a little bit more here, the first box will always be to go to your health assessment and complete your health assessment. We encourage our members to complete an annual health assessment. You can complete the health assessment as often as you like. Some people follow the plan, make some healthy changes, and like to see what their score is maybe 3 or 4 months later. By all means, we welcome people to complete it as often as they'd like. And another feature of our health assessment is that we have included questions related to social determinants of health. So we're always looking to help our members who may have food insecurity, housing insecurity, even personal safety issues, and connecting them with community resources that can help. So that's another feature. Not only will this provide you with a plan to improve lifestyle behaviors or maybe better manage chronic conditions, but we're also looking at those elements outside the four walls of healthcare institutions that we know impact the health of our members, and we want to be sure to connect our members with those valuable resources. So the health assessment is the first piece. And then after you complete the health assessment, or even before, if you'd like to jump into these right away, we have what's called daily habits programs. And it's basically like an online goal tracking or health coaching type program. I'm going to click view plans here and start a plan. It's going to show all the different types of plans we have. They last anywhere from around 85 up to 120 days, depending upon the program. And what you do is you answer a few simple questions. It comes up with different strategies on how you can improve, whether it be asthma or back health, and then puts together a plan. And then this is where the Wellness at Your Side app comes in handy. You track your progress through the program, and it'll give you a smiley face if you're on target. If you haven't tracked something for a few days, you might get a yellow face. And if you haven't opened it up in a long time, you'll get a red frown face. So it's a real simple visual guide to give you feedback on where you are on your status within the program. And you can start or stop or restart any of these programs at any time. So I'm just going to scroll slowly through here. We have a number of different programs related to improving lifestyle behaviors, such as eating healthier, work-life balance, uh, physical activity. Here's one for coping with the blues. Stress management is one you'll see. A number of programs related to chronic conditions such as diabetes, high blood pressure. And then we also have 3 of them here for maternal health. If someone is expecting a baby, you can go through a program for each stage of the pregnancy. And then there's even a program for pregnant partner support. And just a number, staying connected, social well-being. There's so many different opportunities here. So I would encourage you to go in there and take a look at the different type of programs that are available to you. I'm just going to scroll back here and click on My Health, brings me right back to my home page. The next piece on here is what we talked a little bit about, is the health trackers. Again, you can track just about anything. These are the more common items that people track, so they'll appear under this list. If you come down to other, if there's something else you want to track, you can create a tracker. The nice thing about it, it's a one-stop location for all of your information. It will graph it over time, and you'll also be able to print a report. So if you do have to take it into your provider, or you want to print it for some other reason, you'll have all of that information right here in your own portal. And again, the nice thing is this information stays here. It does not go to the health plan. If you're tracking something in here, it does not come back to Security Health Plan. WebMD does not sell this information or any information about you. This is completely for your benefit. And I'll jump back again to My Health, get back to the home page. I scroll down a little bit further. We have a section that's called Take Action. And just, if you're interested in activity, nutrition, stress, again, these little cards, as we call them, they'll change based on your interests that you put during the onboarding process into WebMD. You're creating what is of interest to you. Here's a popular podcast right now. It's called Mental Health Podcasts. And they have a leading expert that goes through a number of different sessions about mental health. And it's one of the more popular programs that we have right now within the portal. And then just different videos, because we have, exercise and eating healthy up there. And these get updated, every, so often. It tells you how long that video will last. So it's a good resource of information for you and to share. And then articles, again, WebMD, online leader in health information. These articles are being updated on a daily basis and likely more frequently. So based on what your interests are, these articles are going to keep coming into your feed. So if you're coming in, daily or every couple of days, you're going to be seeing new articles related to those topics that you're interested in. And that's the full view here, and down into things we've already covered too. The sync the device, your wellness at your side app. Personal health record is different from health trackers. There are some places that use this where they upload claims data. We don't do that. All of that information for you is in your My Security Health Plan portal. And then we have the symptom checker, which is synonymous with WebMD. And then just some additional cards may appear here as well. And let me just slowly scroll back up to the top. And then I'm going to come over to here. You can see this little envelope here. This is where you're going to see different messages for yourself. And the first time you log in, it's going to give you a welcome message. But anything related to a challenge or a reward program, that information will come here. We've also set it up for your reward program that if you complete an activity, it will send an email to you notifying you and giving you a verification that you can save as proof that you did complete the activities. So this is kind of a nice communication center here as well. And I'm going to click on my sponsor now. And my sponsor is just another name for Security Health Plan. So these are programs and services available through the health plan for you. So You can take advantage of our health coaching, which also includes, we have a weight loss program, we have a nicotine-free program. Our care management nurses are available to assist as well. A number of different member resources, 24/7 nurse line, Care My Way, Global Fit. This is a, a free resource for you that you can get discounts on fitness equipment, etc. So I encourage you to check that out as well. 211 Wisconsin, find a doctor. This will be related specifically to your plan. And find a plan. This is for those who may be seeking on the exchange. We have members that might be looking for a different type of plan through that, but that wouldn't be applicable for you. And then over here in the hamburger menu, we can see these same topics again. We have the daily habits, the health assessment. We don't use the health record. Resources is a good link to check into. And again, you're going to see some of this commonality here with what's on your homepage with like daily habits, health assessment, etc. But down here, as we get to the bottom, you can see health topics. I click on this and I can sort any different type of health topic here, alphabetically and jump in. And this is going to show me all of the different resources. Let's click on depression just to show you. It's going to show you any articles, news, and more in this column. I click here. There's different self-assessments you can take. Benefits and planning, that would be more related to us. But these are the two different tabs that you'd be able to find more information regarding this topic. Just going to jump back here and click on my sponsor again to get back to that home page. I'm sorry, I was up at resources. And then the other piece I want to show you here, a couple pieces, recipes. And WebMD has a number of recipes based on, appetizers, beverages, salads, soups, breakfast, you name it. And you can look at each one of these different types. There's a number, many, many, many different appetizers, healthy appetizers, or recipes if you'd like to give those a try. And then the final one that I want to show you is the WebMD video. So basically, again, many different topics to choose from, and it has different videos. And sometimes a video is a lot easier to understand than reading through certain articles. So it's nice that they put a number of visuals that can be used as a health education component. And back here, I wanted to show you one last thing. It's called the settings page. And sometimes when people log in, they may not put in a correct email address thinking, I don't want somebody to contact me about anything. Well, the only communication is going to come from this portal. So when I mentioned the reward program, the challenges, if you don't have an email address that you check here, you won't receive any of those notifications that you completed an activity or completed the overall reward program. If you didn't put in an accurate email, which I encourage you to do right away from the start, you can always come here into your settings and change that. There's also another feature, and you can sign up for online e-newsletters from WebMD. And again, it's as simple as clicking on the ones you'd like to receive and coming back in here, say, I don't want to receive any more on children's health, and just unclicking the box. That's all you need to do with that. And then again, messaging. These are already pre-selected for you. So any participation within the account is going to send you notifications. So if data is imported or you connect a device, these are notifications set up to inform you of what's occurring within your account. And it'll be sent to that email address that you enter. And we'll jump back to the home page. And again, you'll see up here when the reward program comes live, another tab that has rewards, and you'll be able to click on that and view the reward program and start completing activities. And as I mentioned, we'll have that up by next week. We'll be ready to go. Okay, Alexa, I think I'm good unless you have questions related to the portal. And thank you, everyone. Happy to answer any questions you might have.
All right. Thank you so much, Dave. Just one thing that I do want to mention is each year I do send out at the beginning of, usually in September, the benefit spotlight that will list all the wellness activities and what you can complete to earn the wellness credits. Remember, each activity is $300 for a total of $600. And the wellness program does run with the school year. So keep that in mind as well. So I'm going to go ahead and unmute. I know there was just a few, before I do that, there's a few questions in the chat that we will ask, and then I will go ahead and unmute everyone. Dave, if we've had a couple people who've completed the health assessment exam already, or the health assessment in the portal, so we'll be able to get that information if they've already done it to award
Yes.
them
Yes, that
a
will
certificate.
be
They don't have
taken
to
care
pull
of.
out the okay. Okay, perfect. Another question is,
Yeah. Well,
all oh, go ahead.
I'm sorry, Alexa, I'm sorry. Oh, I'm sorry. It was kind of, when you said they completed the health assessment in WebMD already as of
Yes,
since July 1. Oh yeah, the reward
yes.
program will credit you for completion.
Okay, perfect. And then we have another question. So any subscribers that are on the plan, so spouses or any dependent children, will have access to this WebMD portal as well, correct? If they create their own
Yes.
My Security Health Plan
Yes.
account? Okay,
Yes.
but as far as earning activity dollars, that's just so everyone knows, that's just for the employees. So while your dependents will have access to this, the WebMD portal, it's just going to be employees who can earn the wellness dollars. And then the last question that I had in the chat. Will a copy of the slideshow be available? A copy of this presentation will be available. We're recording this presentation, and I will send out a link as soon as it's available. And then another question, what do you mean above by both portals? So again, you have to first enroll and create an account in My Security Health Plan. And if you go out to Security Health Plan's website, you'll be able to register. If you've been registered, or if you've been insured with Security Health Plan in the past, you probably already have an account. And then you're just going to select, if you remember your username and password, that's awesome, and you can go ahead and log in. Otherwise, if you use the forgot my username or forgot my password, you should be able to reset it. And if you have any issues with it, you can reach out to customer service and reach out to Security Health Plan's customer service. So the first step is to create that My Security Health Plan account. And then once that portal is active and you log into it, you'll see here on kind of towards the bottom right hand side of the screen, then you can click on WebMD home, that link, and that'll take you to the WebMD portal that we were discussing. So hopefully that helps. If you have other questions, you can reach out to myself or to Linda, and we can walk you through that process. I think those were all the questions. So I'm going to go ahead and unmute everyone so you guys can go ahead and unmute yourself if you have any questions for Dave or myself. Any questions?
So if I did my health assessment yesterday, even though WebMD is not up and running yet, I'm okay. I don't have to redo it. I'll get credit for it.
Yes.
Okay.
Good question. Any other questions?
I have a question. My son lives out of state, and I did the form to make sure that he had the wraparound coverage. Is there a place in the portal that I can confirm that the paperwork is done and he has coverage?
I think you'll have to call Security Health Plan customer service to confirm that they've received that and they have the correct and updated address.
Okay, thanks.
Yep. Good question.
Sorry. Also another question. So do I have to log into WebMD also for the other $300 credit? Do I have to actually log into that, or am I already good because I was in yesterday?
That is a good question. Are you going to be able to tell, will everyone have to re-log in, Dave, once the portal's active, or will you be able to see whether if someone's already created and logged into that WebMD account?
That should already be taken care of as well.
Thank
Okay.
you. Thank you.
Thanks,
You're
Dave.
welcome.
Any other questions? We will have on-site biometrics. Those will be in October and November, so you can watch for more information on specific dates. My understanding is that you will register for on-site biometrics through the WebMD portal. Is that correct, Dave?
That's correct. There'll be a link in
Okay,
there.
so more information. Okay, some more information will be coming out about that as well. And then if you do have any questions, you can always reach out to myself, or you can reach out to Lindell. We're the benefits team over in human resources with any questions, or you can reach out to the customer service team at Security Health Plan. So thank you everyone so much. Thank you so much, Dave, for taking time today to walk us through this, and I hope everyone has a great day.
Thank you.